All right, thanks again for joining us for today's event. And today's event is Frights and Insights, a follow-up Q&A session. And this is from our Medicare Education Expo that we held last week, or the Medi-Scare Madness event. So today we're going to cover the pre-submitted questions as well as questions that may not have specifically been answered in other events last week. For today's event, I've taken those questions that were submitted and I grouped those into categories. And I'm going to rely on my team and we're going to walk you through how to find the answers and resources for those questions that you have. So now it's time to meet the ghouls and goblins behind today's presentation. These frighteningly fantastic experts have brewed up a cauldron of Medicare knowledge just for you. All right, before we meet those presenters, let me give you the disclaimer that we have to give in all of our presentation, and it basically says the information we're giving you today is as good as it is today. CMS has a final determination in all regulations, and knowing that CMS regulations can often change, it's your responsibility as a provider to follow the most current laws, rules, and regulations that are in place on the day of service you are providing those services. So first up, your first one is me. I'm Mary Sue Gardner. I'm your moderator for today's event. So creeping out of the cobwebs in the covered corners of provider outreach and education, you have me. I am a registered nurse on the provider outreach and education team, and I'm going to be your facilitator again and walk you through today's event. I have 23 frightful years of experience in Medicare, and my focus is on clinical education. All right, also joining from the dark depths of clinical education is my double toil and trouble cohort, Jennifer Boniface. And Jennifer has 24 years of experience in Medicare, and she came to WPS in 2023. Next, crawling out of the crypt of outreach and education and ready to lift the veil on the unknown is Leanne Foster. Leanne brings 25 years of Medicare experience to provider outreach and education, including provider enrollment and claims processing. Always ready to shed some light on the mysteries of Medicare is Karen Curtis. And Karen brings a spooky variety of Medicare knowledge to Poe with 30 years of experience in Medicare. So stirring the cauldron of compliance, we have Aline Sigler, who will be mixing up a potion of policy and precision for you today. Aline has a haunting 28 years of Medicare experience tucked under her cape. Enter if you dare is what we said to this brave soul. So Ashley Dakota, that's what we said to her when she joined the team at WPS here in January of 2025. But don't be fooled, Ashley brings with her 11 ghostly years of Medicare experience, including DME and math background. And just when you thought things couldn't get more frightful, out of the shadows of darkness, I bring to you Mary Muko. Mary is here to summon insights from the world of coverage criteria. If you thought 30 years by Karen was a long time, then Mary's 44 years of Medicare experience is sure to send shivers up your spine. So it's just a little fun we wanted to have today since we were going with the whole Halloween theme of our event. So what is our objective and our agenda for today? And what do we have planned? Our team has brewed up a perfect way to help you through the dark maze of Medicare and follow up on those questions that you had either submitted in advance for the event or ones that you put into the chat today. So we're going to go ahead and get started with today's questions and answers. And so my first questions are going to go out to Jennifer. I'm going to stop sharing so Jennifer can start sharing. And this is perfectly normal. But Jennifer, as you start to share, I'm going to ask you a question. We've received several pre-submitted questions on annual wellness visits and the documentation to support those visits versus sick visit. Can you show providers where they can find the documentation components that like our medical review staff uses and what's really reasonable and necessary for annual wellness visits? So Jennifer?
Thanks, Mary Sue. I just want to clarify before we get started the difference between a sick visit and a wellness visit. So a sick visit focuses on evaluation and treatment of specific health conditions or concerns. And documentation of this type of visit usually includes elements such as the chief complaint, history of present illness, view of systems, and a targeted physical exam relevant to the patient's symptoms. In contrast, the annual wellness visit focuses on preventive care for the patient with the goal of assessing the patient's overall health, updating medical history, and identifying risk factors that support long-term wellness. And it's important to remember that documentation for the annual wellness visit is comprehensive and preventive in nature, and often includes screenings, risk assessments, and the development of the personalized prevention plan. So I'm going to show you a few places where you can find guidance on these required documents. And I'm just going to move this. Sorry, there's something on the screen. So Mary Sue is going to place links to these websites in the chat in case you want to follow along. So I wanted to start with CMS's educational tool, MLN 677-5421, Medicare Wellness Visits. So we're going to just scroll down this page a little bit. You can see, we can tell the difference between the different wellness visits here, a real brief introduction. But I'm going to go down to the middle of the page. So if you go down to this middle page, you'll find a section called Annual Wellness Visits. And if you click on the first Annual Wellness Visit components, it will give you the documentation needed to support this type of visit. So the documentation for the first or initial annual wellness visit includes completion of the health risk assessment, and it does tell you the different components of that, as well as establishing the patient's medical and family history, establishing a current provider and supplier list, measurements including height, weight, body mass index, or waist circumference if appropriate, blood pressure, and other measurements that were deemed appropriate based on the patient's medical and social history, detecting cognitive impairments the patient may have, reviewing potential depression risk factors, reviewing functional ability and level of safety, establishing that appropriate written screening schedule for that patient, and this is a very important component, establishing the patient's risk factors and conditions, providing a personalized health advice and appropriate referrals to health education and counseling services. And this is another really important one that we need to see, and medical review does look for this. Should the patient decide at their discretion, we also can provide advanced care planning services, reviewing current opioid prescriptions, screening for potential substance use disorders, and then performing an optional social determinants of health risk assessment. So our next drop down, so this is the initial or the first one. Next drop down is for subsequent annual wellness visit components. And I'm not going to go through those, but they have very similar components. And again, it's all described out on here. So you can look at this, this guide, and you can find out exactly what needs to be done or what kind of documentation is required. So I just wanted to scroll down to right here, this little box here, and it's called Preparing Eligible Patients for Their Annual Wellness Visit. And this is a really good guide with assisting you with advising patients on what documentation they should bring with them to their annual wellness visit appointment. So I would definitely refer you to look at this just to make sure you have everything you need to perform that annual wellness visit. Additionally, there's a few other resources you can find information about annual wellness visits. So our next one is 42 CFR section 410.15, and it contains some of the same information we just reviewed on that previous document, but it does provide a further clarification of each of the components of the annual wellness visit. And for example, under definitions, we can see the review of the current opioid prescription includes review of potential risk factors for the individual for opioid use disorders, evaluation of the severity of pain, incurred treatment plan, provision of providing that information about non-opioid treatment options, and referral to a specialist as appropriate. And all the different sections are defined a little more clearly in here. So if you want to know what's in a section, you want to know exactly what documentation needs to be in there, this is a really good resource. And I would really encourage you to review the descriptions for each of the required annual wellness visit components if you're unfamiliar with them. Many of our claims are denied during medical review because they're missing documentation to support one or more of these required components. So this is a very helpful document. And it tells you all about what components are there, including the health risk assessment. I'm sorry, I'm scrolling a little quickly. Who can do the annual wellness visit. So it's a really wonderful resource. Our next resource that you can use is the WPS Resource Guide Annual Wellness Visits. So if you go into Topic Center under Medical Review, you can find these or you can just go to the search button and put Annual Wellness Visit in there. This resource again lists all of the required components that are needed for both the first and the subsequent annual wellness visit. I want to point out the bottom of this page where you can find additional resources on annual wellness visits and other useful links, such as the targeted probe and educate review process, which annual wellness visits are currently under. The subsequent annual wellness visit is currently under. Also, our medical review calculator, and a link to how to submit documentation. So these are really good links to also refer to. The last resource I want to show you is MLN 006559 Medicare Preventive Services Chart. And it looks like this. And if you click on this preventive service, you can get to that. So this one shows you the actual codes that were used. So the annual wellness visits codes, that advanced care planning, how we use that. And then that coverage information, who's covered, the frequency, payment, some additional notes. This is about the social determinants of health risk assessment, and just a couple additional notes and some resources and clickable links. And that can give you a wealth of information on what annual wellness visits and the components that are necessary. Finally, before I wrap up and pass it off, I want to remind everyone that we are having a webinar on November 25th at 9 a.m. Central Time, 10 a.m. Eastern Time to review annual wellness visit documentation. And you can register for this webinar by going to the live events page on our training center page. And I'm going to pass it back to you now, Mary Sue.
Thanks, Jennifer. All right, so that leads me into, while you have this up, or actually you can stop sharing and we'll have Leanne start sharing. I'm going to ask Leanne a couple of questions because we received several questions regarding not only rural health clinic billing an office visit on the same day as an annual wellness visit, but other Part B services and E&Ms being billed at the same time. So since we're kind of focused on that right now, several questions came in, from a range of E&M documentation, E&M billing and resources. So I thought you would be best equipped to answer some questions or give some resources of where providers can find more information about E&M. So Leanne?
Thank you, Mary Sue. And this is a question that we get a lot, billing a separate E&M service on the same day as another service. And there's a few things to keep in mind here. So typically, services an E&M is a per diem service, and we're going to pay for one service per day. But there are situations where provider can bill for those separately. One thing I do also want to point out is we get these questions a lot. question a lot with procedures, particularly minor procedures. And what you want to remember is a lot of those, so for instance, I'm going to use injection. A lot of those actually have an E&M component included in them. So that brings me to what we're really looking for those services that are an E&M that's going to be billed on the same day as another Part B service. They have to be one of two things. The first one is significant. So that means that that E&M service that you're wanting to bill separately from the other service on that day has to be above and beyond or at what's typical or a significant amount of work, again, beyond what is typical for the service already being provided on that same day. And typically we're looking at these services that are being provided on the same day with that same provider. The other thing to consider here is the service separately identifiable? So is that E&M service separately identifiable and a distinct procedure from the other service that is performed? One thing that I do want to take you all out to is CMS actually has, and I'll take you out here a couple of times. There's a few other resources that I want to show you, but I want to focus on this one first. They do have, and I'm just going to search. I can't type today. And I'm just searching by evaluation and management, but they have an evaluation and management page, and I'll come back to this in a second. But they have a Medicare learning article, and a link to that's going to be provided in the chat, but also after this session. This is what we refer to as the E&M Services Guide. There's a lot of great information here, and some information has been added recently regarding billing E&M services on the same day as another service. So if you come in here, you are going to actually see on page 7, there is a definition that has been added that goes through the definition from CMS's perspective of what significant and separately identifiable means. So again, what we're talking about is something that is a significant amount of work or above and beyond what's typical for the service already being provided that day, or it's separately identifiable. It's not necessarily going to be based on diagnosis. One of the things that I would ask you to look at when you're trying to decide whether or not you have a separately identifiable service is look at the documentation for each service that's been provided by that provider that day. Look at the documentation for those services separately. And when you separate them, do you have enough to support the service support the service to be billed on its own without the other service? If you do, that is probably significant or separately identifiable service. So take a look at that. The other thing Mary Sue's asking about is the documentation. This is also a question that comes up quite a bit, and there's a lot of great resources out there related to E&M in general, but also the documentation. So WPS has kind of a one-stop shop, and that is the intent, a central location for all things that are E&M. And when you're on our website, if you go under the Training Center and you scroll down to the bottom of that page, we have a Specialty Services Training and Resources Center. Now, this is available for a lot of things. Out on this page, you're going to see information regarding different types of services or specialties, but there is a section that is dedicated to evaluation and management. And this is intended to put everything about E&M that's available that's going to be a useful resource for you in one spot. This is going to include things that are not only WPS, but also CMS resources. And again, there's a couple that I'd like to highlight. First, we've already been there, but the CMS evaluation and management page, this is a central location that has a lot of links to FAQs. It has links to that MLN article that we just talked about. It also has information specific to documentation. And here I just want to highlight that it does have a link to the 1997 documentation guidelines for E&M services. This is a fantastic resource that really goes through what we're looking for, what CMS is looking for in that documentation. I also mentioned that services guide. I took you there, but I do want to show you a couple of other things that are there. And again, links to this is all going to be provided to you in the chat and then again in that follow-up document at the end of this. We talked about the definition of significant and separately identifiable, but there's also a section that is specific to E&M documentation. This is going to talk about the different items and the pieces and what that documentation has to show. Remember, documentation for an E&M service, it has to support the medical necessity, but it also has to support the level of service that's being billed. And this provides a lot of detail regarding that documentation. I'm going to go back to our training page. Another item that I do want to point out here is that we do have a section on this page that has, one moment, a link to a resource specific to evaluation and management documentation. So this is kind of building upon some of the items that we just showed you, but it's also distilling some things down. And this is just general E&M documentation. But we do have one other document that I'd like to show you, and this I generally just search for, but again, a link will be provided. Documentation tips. This is a resource. We're currently reviewing this and looking to see if there are things that we can do to enhance this. But this documentation tips segment is, or resource is, broken up into different types of services specifically. And sometimes we're looking for something a little bit different, whether, you see here we've got a couple of different allergy services, we get into anesthesia, but those services vary just a little bit and we may be looking for something slightly different in that documentation. And this resource can be very helpful when you're looking for something specific to a particular type of service. So those are all going to be some resources that are going to be useful to you as you're looking at documenting your E&M services. So with that, Mary Sue, I will hand that back to you.
Thanks, Leanne. So since you were talking about documentation tips, we received actually a bunch of questions on various documentation guidelines, some of those being service specific, etc. So I am going to share my screen again, and we are going to pull in. All right. I'm just going to ask Leanne to verify real quick that she can see my screen, and I am sharing TMS's page. All right, perfect. So I just want to talk about documentation in general and guidelines, especially if they're service specific. So the first place I'm going to go to when I'm looking for information on guidelines is to Medicare's webpage, because they are the governing body. I'm going to look in the IOMs, and I am going to go to regulations and guidance, and I'm going to search for manuals, and I'm going to go to the internet-only manuals, and I'm going to go to the Medicare Benefit Policy Manual, because the Medicare Benefit Policy Manual is all things benefit and coverage criteria. So it's a key reference for healthcare providers that really details the day-to-day operating instructions and the policies and the procedures, like for Medicare coverage. So it includes a lot of detailed information on a wide range of services, such as hospital stays and home health and skilled nursing facility and rehabilitation services. And it really talks about how those benefits are administered and what's covered and not covered. So you can see some of these on my screen. It might be kind of hard to see. Some of these are purple. That's because those are links I go into all the time. So I'm just going to go into one of these links that I use all the time, and that is Chapter 15. And one of the things that I'm in Chapter 15 the most often doing is looking for information on therapy, outpatient therapy services. So the coverage criteria of outpatient rehab therapy services like PT, OT, and speech language. And I'm in this a lot because I do a lot of education on outpatient rehab services. So this section, especially of the benefit policy manual, does a lot of good, gives a lot of good explanation on the coverage criteria, gives definitions, etc. But as I scroll down, and I know I'm going kind of fast, so avert your eyes if you're prone to seizure disorders or it makes you sick. But I'm going to go down here and start with the coverage criteria conditions. And as you can see, these are broke up into like what you need to have in order for Medicare to pay. So if it's specific in here of what you need to have, guess what? That's what you need to document too. And that's what we are going to use to verify your documentation and that you are documenting correctly. So, you know, like I said, this section of the manual does a really good job. It talks about here establishing a plan. So when we do a review, one of your documentation requirements is a plan of care for that service, whether it's PT, OT, or SLP. And then you can see it talks about the contents of the plan, etc. Gives a lot of good detailed information. However, sometimes the CMS regulations are not that detailed. Sometimes there is a need for further explanation. And that's why sometimes we as contractors have local coverage determinations, or CMS may put out a national coverage determination. So I'm just going to return by clicking on the CMS logo to the home page. And I'm going to show you how to find information on LCDs and NCDs in just an easy way. I'm going to click on Medicare, I'm going to go to coverage, and I'm going to go to Medicare coverage database. And you can even use the search and just type in Medicare coverage database or MCD if that's your preferred method of finding the information. So you might have a couple of different options, but it's all going to take you to the same place. All right, so I can search, do a keyword search. And since we were talking about outpatient therapy, I could keyword search by outpatient therapy. But I want to make sure we're choosing a state that is in a WPS jurisdiction. So I'm just going to choose Iowa and see if anything comes up for outpatient therapy in Iowa. This is CGS, so that's not us. They have something on physical therapy and home health. There is intravenous insulin, which doesn't pertain, physical therapy and home health, again by CGS, and there's a wound care from WPS. So you can see we do not have a specific LCD on therapy services. And that's actually because the rules and regulations in the benefit policy manual are so good on that service that most contractors have eliminated having a separate LCD. If I go back to the coverage database, and let's just go in here and see if there's any NCDs. And I'm just going to search by all states. And you're going to see that just by searching that, I get an alphabetical list of every single NCD or national coverage determination that CMS has in place. So that's another way you could scroll through and search, but if we scroll down to therapy, you're going to see that there's nothing. If I would search by physical therapy or occupational or speech language, there's not an NCD there as well, because again, it's so well defined in other places. But since we're in the NCDs, let's just pick one NCD and show you how you can find information in a specific NCD. And we're going to go to, let's see, one that I look at a lot is prothrombin time. All right. So if I can spell, and I'm not seeing it on just a quick search, so I'm going to do 190.17 because my eyes aren't working with me today. So a PT blood draw. And if I were to scroll into this document, I can see that there are indications and limitations of coverage. Since there are indications and limitations of coverage, guess what? That's what we're going to expect to see in your documentation. So a PT may be used to assess a patient that's taking warfarin. So we're going to need to see documentation of warfarin if the patient's taking that or what other medications they are taking. And signs and symptoms of abdominal bleed or thrombosis, I'm sorry. So we're going to look for some of those examples that are listed here, et cetera. So using an NCD and using an LCD kind of work in the same way. So if I were to just back out to the coverage database again, and let's say I'm going to look for, and I could do just a general LCD search, and I could use the state of Iowa again, because I know that is a state that's in our contract. And I can see again an alphabetical list of LCDs that we have listed there. So if I wanted to go into a specific LCD, and let's say allergy testing, that one's right here at the top. And if I open the allergy testing and accept the licensing agreement, first thing I always want to do when looking at an LCD is make sure it is for us, because if we are your Medicare paying and processing contractor, you should only be following our LCD. You shouldn't be using some other contractor's LCD. So it is a WPS LCD. And then again, some additional information, but coverage criteria, limitations, and medical necessity. So these are all the different components that we're going to look for in medical review if you happen to do allergy testing and we happen to request that information. So again, one thing that is unique or different to an LCD as opposed to an NCD is generally an LCD, not always, but almost always, will have a billing and coding companion associated or billing and coding article associated with it. And this will also give you indications of medical necessity. So always look here and make sure if there's any additional documentation guidelines. But it also will tell you what codes to use and if there are combinations or certain amount of codes that need to be chosen from different code groupings that have to be on your bill. The article is going to give you that indication as well. But also, like I said, sometimes there are documentation guidelines that help with that included. So make sure you're looking at both components. Now, I'm going to show you some really quick places on the WPS website. And let me go ahead and just click on a quick link for us that you can find documentation info. So when you go out to our website, make sure you're using the jurisdiction and MAC that you are part of. So it's important that you choose the correct jurisdiction that you're in and you're using the correct part for the information that you're looking for. I'm just in J5A, so I'm going to go to Topic Center and I'm going to click on Medical Review. If I scroll down to Targeted Probe and Educate, you're going to see a list of various services that are under review for Targeted Probe and Educate for our J5A providers. If I switch to J8A and I scroll down again, you're going to see that list is slightly different. If I choose a service you're going to see that there is various information available. Now, this service, outpatient therapy, I'm just sticking with the same theme, happens to be under review in all jurisdictions and all parts right now. So you're going to see, you'll find information in here about the review of that service. So that's one place to find information, but you can also, if you go to our topic center and you go to claims and you scroll down, sometimes we have some specific documentation guidelines that we have just for various providers, or just for providers to use, because we don't have it under review, but we might get a lot of questions on it. So under the jurisdiction and part that I'm under now, we have some additional ones on chronic care management, and you're going to see this is going to give you all sorts of additional documentation that we would expect to see if we were to do a review for chronic care management. So one thing, if we go back to like therapy services that are under targeted probe and educate, is one of our recent reviews that really drove the fact for us to look at outpatient therapy as a whole is the KX modifier use. Whoops, and if I could type that. And obviously I still can't type because I don't have my fingers on the right keys. So we have a KX modifier fact sheet that I wanted to show you. So, you know, the thing about the KX modifier is that this drove the need for the targeted probe and educate, and then additional outpatient claim reviews, because we needed to ensure that this modifier was being used correctly. So when this modifier is appended to a claim, it's your way as a provider to attesting to the fact that they know that the patient has met a Medicare payment amount threshold for billing, but the service continues to be medically reasonable and necessary. And then the burden of proof comes down to your documentation to show us why continued services in outpatient therapy are medically reasonable and necessary. So my suggestion is to always do a keyword search on our website. We may have documentation guidelines that are useful in places other than the medical review section of our website. And a keyword search will also bring up medical review information, you know, if we have it as well. Anyway, since I ended a second ago with talking about the modifiers, I'm going to quit sharing, and that's going to lead me to additional questions that we received on the use of modifiers. So I'm going to turn things over to Karen. And Karen, we received several questions about the use of various modifiers. So there wasn't any specific one. There actually happened to be questions on 3 or 4 different ones. Can you show our providers some resources that we have available on modifiers and where they can find additional information on various modifiers?
Thanks, Mary Sue. Sure. Let me share my screen real quick here. Get some of these gray boxes out of the way. Can you verify that you are seeing the CMS NCCI webpage?
I am.
Okay, great. Thank you. So modifiers is one topic that always generates a lot of discussion and potential confusion, but CMS and WPS do have resources that I think will be helpful. Frequently, when I am looking at my pre-submitted questions, specifically for preventive services, a lot of them are asking, can I build this specific service along with whatever topic I'm covering? And this happens a lot, especially like with annual wellness visits, because one of those components is to review for depression. And so a lot of providers are like, well, can I bill for depression screening along with an annual wellness visit? So the first place that I wanted to start was with the NCCI edits, the National Correct Coding Initiative. Over here on the left-hand side, you're going to see a Medicare NCCI procedure to procedure edits, and that's where I want to start. There are separate downloads. Hospitals has their own, and then practitioners have their own. And you can see that the downloads are separated by HCPCS codes or CPT codes. So you'll just need to find what code you're specifically looking for, and kind of that's what you're going to want to download. I previously downloaded this one, and I have it ready because I didn't want you guys to have to wait for me. But you'll see that the NCCI tables, they're broken down into two columns. That column 1, that's going to be your payable code. So when you search for your CPT or your HCPCS code, you're going to want to make sure, like that annual wellness visit, you're going to want to make sure that's in column 1. And then when it comes to column 2, that's where you're going to look for the code you want to bill with that. So in the examples that I got, column 2 is where you're going to have your depression screening. Now, if we move over, it tells you the effective date, if there's an edit put in place, the effective date, if there's a deletion date. But what I want to call your attention to is this column right here, which is for modifiers. So if this column has a 0 in it, that means that the two codes that you're looking at cannot be billed together. There's no situation where we're going to pay for both of those codes. If you see where there's a 1 in there, that means that the two services could be billed together with an allowable modifier. So that was kind of the first thing I wanted to show you, where you could look at that to see even if the codes are allowed, and then if they are allowed, I have to put a modifier with it. We have done a lot of education on the NCCI tables and how to use these tables, so there is education on our YouTube channel if that's something that you want to get more information on. CMS also has an MLN where they take you through the NCCI tables and how to use those. And one of the links that they have in there is for proper use of modifiers 59, XE, XP, XS, and XU. So once you find out if your codes can be billed, then here you can look, and this is going to help you define what modifier you're going to want to add with those codes. So it goes through each of the modifiers. It gives you a definition. It explains appropriate and inappropriate use of these modifiers. And I'm sorry if I'm scrolling too quickly. There's a whole section. We get asked a lot about, is rural health clinics, do the rules apply to them? Is it different? So they have this whole section here just on rural health clinics and federally qualified health centers. And then it even gives examples of appropriate and inappropriate use. So that would be a really good resource that you could use. One other resource while we're out on the CMS website that I did want to call your attention to. Now, this, Mary Sue had taken you out to the Medicare coverage database, and she had talked about the contractor information and whether it's WPS or not. This was one that was put out by Noridian, but we have been told by our appeals department that there does seem to be a lot of confusion with the usage of modifiers JW and JZ. I know my coworker Aline did a webinar on this, but I did want to show you this also because this does cause a lot of confusion. It causes a lot of work for our appeals department, and there does seem to be a misunderstanding about when it's appropriate to use these modifiers. So that resource is out there also. Now I want to move to the WPS website because, to be honest, I think that we have a lot of resources available out there. There is on our quick links, there is a link right to the modifiers page, but because the quick links can change, I do want to show you how to get there otherwise. So if we go to the Topic Center, we're going to click on Claims. Then we'll scroll down for the topics. And down here we have modifiers. So I'm going to click on that. Now here I am in J5 Mac Part A, but you will definitely want to make sure that you are in the correct jurisdiction. Part A is going to pertain to modifiers that would be billed on a UB04 or an 837I. Part B is going to be if you are looking for modifiers to bill on a CMS 1500 or an 837P. You can see if I switch this top category, just general modifier information, goes from 3 resources to 1. So that really is going to be important that you are clicking on the right jurisdiction. Now each fact sheet that you open is going to have a definition. It's going to have appropriate and inappropriate usage. Here you have additional information. There is some that will even provide examples of correct usage along with some additional resources. And like I said, I just think that if you look out here, there's so many modifiers that we cover. And I think that our team that put this out there just did a really great job. Now, the last resource that I want to show you for modifiers is the CMS Government Services Medicare YouTube channel. So this is our YouTube channel. We put all of our encores out here. If we go to the playlist, let me scroll down here. We actually have a whole playlist that is just of modifiers. So Mary Sue talked about the KX modifier. If you go out here, there's a lot of education that Mary Sue has done for the KX modifier that's all out here. But you can see we've covered a wide variety of modifiers. We had our modifier Mondays a while back, and so those are all out here. So just a really great resource. Depending on what modifier you're looking at. Now, another one that I do want to call your attention to before I turn it back over to Mary Sue is this very first video, which is ambulance suppliers using modifier GY. This is another one to check out if you're an ambulance supplier, as this is another topic that was brought to our attention by the appeals department. So another great resource for you. Mary Sue, I'll turn it back to you.
Thanks, Karen. If you want to quit sharing, that is going to lead me into additional questions that we had. So, hey, Aline, Karen just made mention about ambulance modifier. And since we're talking about ambulance, we actually received questions that were specific to ambulance services. And these questions range from what documentations are required, to RASNAT services, et cetera. So can you show our providers where they can find some ambulance-related information?
Sure, I can. Thanks, Mary Sue, and thanks, Karen. Thanks, everybody, for participating today, attending our Medicare Education Expo, submitting all these great questions. I brought you out here to the WPS website, and I just happened to be in J5 Mac Part B, and I know you've heard the other speakers talk about how important it is to kind of know where you're at out here, because some things are only for Part A or Part B, things like that. So what I want to do is I want to take you to our training center. You know, we've got a lot of information out on our website. It's sprinkled around in a lot of different places for many different types. Ambulance is no exception. So maybe you didn't even know that we had a dedicated area in our training center. So clicking on training center, I'm going to scroll down. Leanne had you out here just a little bit ago, down here in our specialty service training resources. And they're in alphabetical order. So you can see that ambulance training is first on the list here. So I'm going to select it. And then you can see we just have a list, kind of a compilation here of a lot of resources for our ambulance providers and suppliers. I'm going to select it like I did. I'm going to open that page for you. I'm not going to go over every single thing on this page here. My main goal is to let you know it's here, that it exists, and how to find it. I am going to go down the page though, and I want to highlight a few things for you. There's some information about the National ABMAC Ambulance Provider and Supplier Coalition. And this is fairly new this year. All contractors across the nation are working together to provide unified education and answer questions. So we've had 2 events so far. You can see we had our last one in September. There's a link to the presentation that was used. And soon you'll see this page updated with the date for the next event. So you'll want to come back here and check it out if that's something that you're interested in. I'm going to go back. And the next thing that I want to mention is the ambulance specific resources section right here. You can see there's a number of different items under here. We have links to other pages on our website. One about ambulance benefits. If I just give you an idea here of the things that are out here. A little bit about medical necessity, mileage, etc. Going back. See what kind of information the ambulance billing page has. Details about origin and destination modifiers. Let's see. Information on zip codes, signatures, procedure codes, among other things. And then as we go back to this dedicated page, you see we also have pages that are dedicated to documentation, enrollment, reimbursement. So I want you to go out and take a look at any of those things that you're interested in. If you think they can help you, if you want to pass them along to someone else that you work with. I do want to show you the Billing Medicare for Transport's decision tree right here. And this is a neat resource because it's interactive. So based on the answer to some key questions, it can assist you and point you to other resources here. So I'm going to click on Begin Questionnaire just so you can see what it looks like. So it's going to ask you questions. Is the service documented? And if we click yes, it's going to take us to the next thing. Did the EMT perform and document an assessment? If so, see how it just kind of takes you through some questions. Now this one, did the ambulance transport the patient to a covered destination? Well, based on the information here, what if they didn't? So then what it does is it tells you why the transport may not be covered, and it also gives you some other key resources here. So I just wanted to show you, number one, where that is, what it is, and how you can use it. So then what we're going to do is we're going to go back up to the training center here. Back to our ambulance specialty page. And then what are we going to look at here? After the decision tree, let's see, we have a link to the CMS website. Let's scroll down a little bit. So we have some CMS resources here, a couple manual references here, some information about the ground ambulance data collection system webpage. In the next section about medical review resources. let's see. We have this middle bullet, which is an article on our website about ALS and reviews for ALS. What other information do we have here? The other two bullets here are about the prior authorization of repetitive scheduled non-emergent ambulance transports that we call RASNAT. If this is something that you provide and that you have to do, here's some resources for you. WPS has a page dedicated to the topic as well as CMS. So you can see links to both of those here. Now, one thing that I do want you to know is that if you've submitted a prior authorization, I want to be sure you know how to check the status of that request. So for that, I'm going to take you back to the top of the page, and this time we're going to go to Tools. We're going to select Tools, All Tools, and then I'm going to scroll down to the last row. It's actually the last tile in the last row, Prior Auth Request Search. So repetitive scheduled non-emergent ambulance isn't the only service that requires a prior authorization sometimes. So when you get to this tool and you fill out the form, the very last item under prior auth type in that dropdown, you can see there's your repetitive scheduled non-emergent ambulance transports. So you can actually check on the status of your prior authorization requests. Another thing that I want to show you while we're in Tools is right here on the left, All Forms. And I'm going to select this because I have something I want to show you here. And I'm actually going to sort this list by specialty and service. And when I do that, you see that we have a form related to ambulance. And if I expand this section, you can see that it's a physician certification statement for ambulance. So this is a sample form that we've put together that you can use if you choose to. And as long as you have filled out this form and you have all the elements here, you should have all the information that's needed. So I wanted you to know that it's available should you use to choose it. This particular form is not required. It's just here if you want it. Now, one last thing that I want to tell you about, gotta go back here. And it's also in the training center. And Karen had you out here a little bit ago, and that's our YouTube channel. So on our YouTube channel section of the training center, I'm going to scroll down to the specialty services section. Look away if this bothers you. So here under specialty and services, ambulance suppliers. We have a YouTube playlist dedicated to ambulance suppliers. We currently have 25 videos out here. Mostly they're recordings of previous education, but we also have some shorter videos on specific topics. So for example, we have a video here, ambulance transports for hospital return trips, 8 minutes in length. So it's just a wide variety of different topics that we have educated on. And one recent one that we've done that I want to mention is the EMT assessment. A couple weeks ago, Mary Sue and another person on our team, Tom Ryan, held this webinar. If you missed it, it didn't fit into your schedule, it's out here. You can watch it now and still get that education. So I hope that using these resources will help you find the answers to a lot of the different questions that you might have, whether you're an ambulance provider or you bill another type of service. So I'm going to check in with Mary Sue now before I hand it off to our next speaker.
Noeline, that's great information. So you can stop sharing. So Ashley, we received actually some additional questions about where providers can find like past education or information about a specific service or a specific type of review. So can you share with our providers the same page as Aline was showing, our YouTube page, and or other resources where providers can find information on education that we've already conducted?
Yeah, sure thing. Mary Sue, first, could you confirm that you can see my screen and you can hear me okay?
I can, loud and clear, and I'm seeing the WPS page.
All right, perfect. So we're going to start here, which again, this is our WPSGHA.com website. I know we've shown you a few resources here already today, and I think many of you might be familiar with this page. We're going to start by going up again to our training center. And again, you've seen some resources here today already. And right here from the training center, you do see YouTube videos. The reason I wanted to take you to YouTube this way is because I wanted to point out this box to the left of our YouTube videos where you see encore presentations. We do understand that not everyone can access YouTube from work, and this encore presentations tab is where we post videos right to our website where we have a player built in and you don't need to access YouTube to watch those. But for YouTube, if I click here on See Playlist, this page will open, and right up top you see you have a link to go directly to our YouTube channel. This page also lists links that go directly to each of our YouTube playlists, but I'm going to go out to our YouTube channel to show you more of what that looks like, and I'm going to click on the link right here from the top of this page. When you get to our YouTube channel, you'll be greeted by our colleague Tom with a short video here introducing WPS. So if you happen to be following along today, feel free to pause that video if maybe you're already familiar with us as a Mac, or if maybe you want to watch that later if you're not as familiar. One thing to keep in mind with watching our YouTube videos is that you won't get CEUs or have the ability to ask the presenter live questions, so we do still encourage you to come to live events such as this one when you're able to do so. All right, so now I'm going to click on Playlist, and it takes me to this page which has a list of our playlist where the videos are all organized by topic. If you wanted to sort these, you could go here and sort by the date the playlist was added, or my preference is to sort by last video added. You will find that some of our videos apply to more than one topic, meaning you may see the same video listed in multiple playlists. For example, the recording of our webinars, we call those encores, and you can find those in the encore presentations playlist, as well as in the playlist that's specific to that topic. So in this encore presentations playlist, you see right away that we have recordings from the Medicare Education Expo Medi-Scare Madness event from last week, in addition to all of our other recorded webinars. We also have a playlist that is specifically for our Medicare Education Expo, right here. And here you'll find videos from the sessions, again, that we did for this event and from our first Medicare Education Expo that we held back in July. And again, these videos are also in the encore presentations playlist that I showed you. For the next playlist, Leanna and I also provide education on evaluation and management, or E&M services, and I know she showed you some great resources already, but another is right here on our YouTube channel. So if you look at our E&M playlist by clicking on View Full Playlist, here you're going to find we have our two-part series that we've done recently that you see identified by Part 1 and Part 2, and many other videos on E&M services such as emergency department services, office services, and so on. We often receive questions on level of service, and we do have a video specifically on choosing your level of service on the E&M playlist. We've also had some questions in this event on the proper use of G2211, and I did a webinar on that back in July, and the encore is also right here on this playlist. Another thing I want to mention for YouTube is that you do have the ability to provide feedback on our videos. So I've opened up a video from one of our two-part E&M series just to give an example of this. And I'm going to scroll down just a little bit and I'm going to click on More, where you'll find a description of the video and links related to the material presented. You'll also find here, or on all of our videos, links to a survey that's specific for that video, and we welcome any feedback that you might have on that particular video. At the bottom here, something we added based on survey feedback, which is chapters, and these chapters will take you right to the specific parts of that video that you might be interested in. So let's look at a few more things from our YouTube channel playlist. First, for those who attended my Part B session last week, we also have a playlist on billing MCS, you see right here, where you can find more information specifically on Part B billing. And if you're one who attended Aline's Part A billing session, or if you bill Part A, we have this playlist out here dedicated to FIS billing. So there's a few more. I know that we've already shown you some of these today, but we have a playlist for documentation. So you'll find more information there related to what Mary Sue was talking about as far as documentation requirements. There's again, we have the ambulance suppliers playlist, which Aline showed you. And then down here, again, we have a modifiers playlist. We even have a video on Modifier 25 for those of you who are looking for information on that modifier. That was one of our Modifier Monday videos within that playlist. So you can see we have lots of information available in these playlists. The last one that I'm going to point out here is something that's really been a hot topic lately, which is telehealth. Here we have the telehealth playlist. So if you're looking for more information on telehealth, I do encourage you to check this playlist out. There's a really helpful video that was just added about a month ago where Mary provided information on the past, present, and future telehealth requirements. All right, Mary Sue, that's all I've got for our YouTube channel. I will hand it back over to you.
Thanks, Ashley. That's really helpful because telehealth has been a hot topic. And speaking of telehealth, we received several questions about telehealth. So I'm going to ask Mary if you can take the mic over and take the screen share over and provide some information for our providers on telehealth services that might be helpful to them.
I sure can, Mary Sue. Thank you so much. Can you hear me okay, and can you see my screen? I'm sharing the telehealth.hhs.gov site.
I can see your screen and I can hear you loud and clear, Mary.
Perfect. Well, I have a few things that I want to show you here relative to telehealth. We have received so very many questions about telehealth recently. As most of you are aware, I'm sure some Medicare policies for telehealth have recently reverted back to those in place before the public health emergency, or the PHE. And these changes are based on laws. CMS can't change these, only an act of Congress can do so. Remember that telehealth policy for mental and behavioral health services is different than for other telehealth services. So be careful when you're looking at all of the great resources available out there, and make certain that it's pertaining to the services that you are rendering and billing. CMS has published details about telehealth in their special edition MLN Connects newsletter on October 1 of this year. And I'm going to pull that over here and show you what this looks like. If you go out to CMS's website, you can find their MLN Connects newsletters listed, or listed by the date that they were published. And there was a special edition Connects newsletter on October 1 of this year, and you can see that it's labeled Special Edition, and that has some updates on telehealth in it. In addition, just recently on October 15th, they also published another special edition of a MLN Connects article, and that talks about some claims hold updates, which does include some description or some rules, if you will, or some information about telehealth. I've asked a teammate to place links to these CMS communications into the chat. They're all helpful. There's a handful of them. And just to make certain that you get all of that information that you might be looking for, I'm going to follow up after today's webinar and provide you with those links. There may be other links that some of my teammates want to provide to you also. So keep your eye open for that particular email. I'm also sharing this page. This is one of my personal favorites, my go-to when I'm looking for telehealth information. This is the telehealth.hhs.gov website, and this website provides information for healthcare providers and patients about the latest federal efforts to support and promote virtual healthcare, which is known as telehealth. It was actually built by the Health Resources and Services Administration, or HRSA, which is an agency of the United States Department of Health and Human Services. So this has a lot of great information here. We get a lot of questions about licensure. You know, can my provider who's located in this state render telehealth across state lines? So this is where you want to go for that kind of information. A lot of good information here, both for providers and for patients. So a lot of great information, and you can scroll down and just click on these tiles to easily move around. Another resource is one that Ashley just mentioned, and that's that recording of the September 9 webinar that I facilitated. It's called Overview of Medicare Policy, or Medicare Telehealth Policy, Past, Present, and Future. So you can find that recording available out on our YouTube channel if you missed it, or if you want to listen to it again. Again, I'm going to send all of these links to those that are attending this presentation today after we get our attendance list from WebEx. And remember, if you are attending by telephone only, your name or your email address won't appear on our attendance list, so you'll just need to send us an email to our education mailbox to ask that we send those links to you. So Mary Sue, if you could go ahead and pop in our education mailbox email address, that would be great. Now, there were some questions during the post-payment review webinar that I facilitated last Thursday as part of the Medi-Scare Madness event that pertain to the 935 overpayment appeals process for WPS prepayment reviews. My prepared remarks did not delve into prepayment review, overpayment, and overpayment appeals. But following the webinar, I did reach out to the medical review team to get responses to the chat remarks and those questions that were placed into the chat for those topics that I didn't include in my prepared remarks. So earlier today, I sent the responses in an email to all of those on the WebEx webinar attendance list. Now, if you attended only by phone, your name is not on that list. So again, send an email to our education mailbox and ask for a copy of the email concerning the 935 overpayment appeals process, and we'll share that email with you. One other question that we received in the chat and did not respond to during our webinar was related to contact names on Mac communications. And the chat actually reads, on Mac audits, the requests are sent out with a contact name. However, there is no contact information. How can you communicate with your person? The individual claim additional documentation request or ADR letters would not contain a contact name, which is why WPS reaches out to obtain a point of contact prior to the reviews starting and educate the contact on the review process. So that is the manner that we get that contact information out to providers. Mary Sue, that wraps up my prepared remarks today. I'm going to turn it back over to you.
Thanks, Mary. We have just a little bit more time, and I'm going to circle back around to Leanne. If you want to quit sharing, Mary, I'm going to ask Leanne, just because it's come up several times. We had some questions that came in that talked about submitting provider enrollment applications that were left over from your seminar last week. Would you be able to share some resources that providers can use to complete the enrollment application in a smoother manner?
Absolutely, Mary Sue. Can you just confirm that you can see the WPS webpage and hear me okay?
I can see and hear both. Fine.
Beautiful. Beautiful, thank you. Yeah, so we get a lot of questions. Provider enrollment can kind of be a little bit complicated and a little overwhelming to navigate. So I do want to share some of these. I did share during my session, but I've got a couple of other things I want to share with you today. From our website, underneath the Topic Center, if you go into provider enrollment, there's a lot of great resources out here. One of the biggest questions that we get, though, has to do with PACOS. Always about PACOS and navigating that system. That system is the only electronic method of submitting an enrollment application, and there are a lot of really good resources. One of the places that you can look, Ashley talked about the playlists on our YouTube channel. There are actually quite a few provider enrollment specific couple of playlists, but quite a few videos specific to completing the paper applications, but also functionality in PACOS. If you attended the provider enrollment webinar this week, those links were provided, but I'll make sure they're sent out with this session as well. Under our guides and resources, though, there is a link that takes you directly to our Provider Enrollment Chain and Ownership System page, or also known as PACOS. This just goes through a really high level of what PACOS is, and then it gives you a lot of really good links. And there's a couple things I just want to show people. This first is the Identity and Access Management System. This is a page, and it's just going to ask me to confirm that I'm using this for the appropriate purposes. But the first thing is Identity and Access Management. Now, this is separate from PACOS. Just want to make it clear, this is a question we get often, that this is a user ID and password, basically a security management system. This in itself is not PACOS. But before you submit electronically, you have to go through this system. And if you need to set up for your first ID, it will walk you through that step. The resources out here I want to point out, though, are the quick reference guide and the frequently asked questions for this. This actually takes you step by step through that identity and access process, includes the types of actions certain users can take. So this is a really good resource if you're just getting started with PACOS. Also, there's a frequently asked questions document that offers a lot of good troubleshooting information. The other thing that you will see here is I'm just going to go back one page. Nope, it's not going to let me. One moment. The other thing is going to be the actual PACOS system itself. And the first thing that I want to go out to is just the CMS website. I went to the wrong spot. My apologies. Under Medicare, if you go to Enrollment and Renewal, Providers and Suppliers, this is the CMS provider enrollment page. This also has a lot of really good information. You want to go under Medicare enrollment for providers and suppliers. Here you will see a link to the actual PACOS system itself. So once you have access, you'll want to come out here. Or if you have access, this is your login page. This is where you will start an application, whether it's an initial enrollment, a change, whatever you happen to be doing, revalidation. But at the bottom of this particular page, CMS also has various tutorials based on the type of enrollment application that you're submitting. These are also very helpful. Our videos are focusing on getting started, getting signed up, and the various actions. These will actually walk you start to finish through some of those enrollment applications. So those are great resources for you. Also on our provider enrollment topic center, you are going to, and I typically go A to Z here, but you're going to see all of our enrollment resources that are available. And there's a couple that I want to point out for you today. One is going to be the provider enrollment checklist. This is a downloadable document that actually goes through all of the information that you're going to need to have gathered to either complete the electronic or the paper enrollment application. This includes documentation that you might need. This can be very helpful when you're trying to coordinate with your providers and make sure you have all of the appropriate information. Additionally, there is a resource that will help you decide what application that you need to complete, and that's our provider enrollment decision tree. Now, this is a resource that's going to ask you a series of questions about the type of enrollment action that you're trying to take. And based on how you answer those questions, I'm just going to go through a couple of them. It will take you to various resources for the various provider specialties that are eligible to enroll in Medicare. And this will tell you whether or not an enrollment fee is required. It will tell you what application is required. It'll also give you links to Chapter 10, which is the IOM for the Internet Only Manual that actually governs everything provider enrollment. And since we have a little bit of time, I do want to take you out there as well. So taking you out to the CMS website from here, you already saw this. Aline and Mary Sue both took you out here. But if you come out to that Medicare website under, I usually go under manuals, forms, and transmissions, but you'll see the Internet Only manuals. Here I'm going out to the Program Integrity Manual, which is 100-8. Once you're here, you're going to go to Chapter 10 for Medicare enrollment. This is the manual that oversees everything enrollment. The enrollment process is very transparent. This includes everything from what the provider is expected to do to what the contractor is expected to do, including timelines for the enrollment process. So if you're ever looking for documentation based on for what the requirements are for a particular provider type, you will see all of that information out here as well. This also includes information about providers that are not eligible to enroll in Medicare. So if you need that, that is out here as well. And one more item out here before I hand it back to Mary Sue. I do want to point out the provider documentation resource that we have out here. We get a lot of questions about what type of documentation needs to be submitted with my enrollment application. And this is a resource that will go by provider specialty, and it will list out the types of documentation that we will need to come in with that enrollment application, right down to licensure and adverse legal action documents, what IRS paperwork that we need. So this is something that will really help make that enrollment process a lot smoother for you. And with that, Mary Sue, I'm going to hand it back to you.
Thanks, Leanne. Very helpful, especially for those questions that we got in regarding, specialty services and provider enrollment, and just finding that information all together. So thank you, and thank you to all of our presenters. That is the end of the questions that we received and helping you guys find the resources to those questions. Because some of the questions that we received were so specific to a certain provider type, I really felt that we would be able to provide better education with showing you where to find the information overall for that type of issue. And my team knocked it out of the park with those resources and that information that they provided. So with that being said, you're going to see another little gray box appear. That's just me moving some stuff around on my screen. I'm going to double check the chat, and I do not see any questions in there that we have not already addressed. So I am going to move on in the interest of time and let everyone move on with their day. As I stated, at all of our presentations, I want to let you know your opinion matters, and we value your opinion. We want to know if this event was helpful as a follow-up and to find all those great resources and additional information to help you get your questions answered. So I did plug a survey for this event into the chat. This is one of your opportunities to take the survey, or you can wait till this session closes, and a box is going to come up that looks like this. That you'll be able to click on. It'll take you directly to the survey. As Ashley had mentioned, we take your comments seriously. We develop additional education. We try to make things as easy as we can for you as a provider and get you the information that you need to do your job and do it correctly. So not only is this your opportunity to tell us, how'd you like this event? But it's your opportunity to say, hey, this is what I need in the future. And with that being said, on behalf of myself and all of my team, as well as medical review and appeals and provider enrollment, we want to thank you for your participation in today's event. If you have additional questions, you have 7 days to submit those to that email address that we put in the chat several times. Go ahead and submit those. And as we mentioned before, we are going to take all the resources that were in the chat. So don't fear if you missed something. I'm going to send those out as an email. And then there was a few one-off questions that really didn't fall into one of these boxes. And I'm going to send the answer out for those questions to everyone as well. So again, thank you for participation. This concludes our webinar, and you may now disconnect.